Hello, my name is Dr. Dev Mehta. I'm a heart doctor out of Fort Worth, Texas. In this video on the topic of hypertension, I will go over the scope of this problem in the United States. I will describe the accurate way of measuring your blood pressure at home. I will describe what is white coat hypertension and talk about early signals to detect blood pressure related organ damage. Now, normal cutoff for blood pressure is less than 130/80 millimeters of mercury in the United States and less than 140/90 millimeters of mercury in Europe and other parts of the world. Currently, almost 1 out of 3 adults in the United States has high blood pressure or hypertension, and of these, almost half do not have their blood pressure adequately controlled. In fact, 1 out of 5 people who suffer from high blood pressure are not even aware that they have this important medical problem. And this is because high blood pressure does not cause any symptoms for several years. Well, we can say that what is the big deal with elevated blood pressure readings? It is an important deal because high blood pressure is the primary contributing cause of death for almost 500,000 people every year in the US alone. That is nearly 1,400 deaths every day. Even modest reductions in blood pressure can result in preventing thousands of heart attacks, strokes, congestive heart failure, and kidney failure events. Now, the most common method of measuring blood pressure is with an inflation cuff placed around the arm in the doctor's office. This situation is almost always associated with some degree of anxiety and stress. This can result in elevation of these blood pressure readings. Many studies have shown that on average, blood pressure readings taken in doctors' offices can be 10 to 15 points higher than those checked at home. This phenomena is called white coat hypertension. However, we know that the blood pressure readings that are taken at home are more important and predictive of future events as compared to isolated checks in physicians' offices. Therefore, the home blood pressure number should be relied on more to make lifestyle and medication treatment decisions. Well, what is the best way to check your blood pressure readings at home? For one, we should start by selecting the right-sized cuff for us. The length of the blood pressure cuff should be at least 80% of the circumference of their arm. Undersizing of the cuff can result in overestimation of the blood pressure by 20 to 30 points. We should be sitting comfortably and quietly in a chair for several minutes with our legs uncrossed. The cuff should be placed on the arm around the level of the heart in the body. It is advised to check your blood pressure usually on 2 occasions every day and maintain a log of these blood pressure readings. We strongly encourage all our patients to bring the log of these readings from home for their appointments and visits with us. Elevated blood pressure readings over several years can result in major damage to different organs that can later present with strokes, heart attacks, heart and kidney failure. Before somebody develops these serious health events, there is usually evidence of minor degree of injury to these organs. These can be picked on easy tests and physical examinations. One of the earliest changes can be seen with the effect of blood pressure on the tiny blood vessels in the back of the eye called the retina. This condition is called hypertensive retinopathy. This can easily be identified with an eye exam in the eye doctor's office or with the optometrist. High blood pressure also affects the kidneys and can result in leakage of proteins into the urine. This abnormality can be detected with a simple urine test in a doctor's office. Effects of high blood pressure on the heart can be detected by an EKG or an echocardiogram, which reveals a more muscular heart. If there is evidence of end organ damage to one of these organs, then one needs to be more aggressive with their blood pressure control to minimize the risk of major events from occurring down the road. I hope you found this information useful. If you did, please click on the like button at the bottom. Please consider subscribing to my channel if you are interested in receiving information regarding other important health related topics in the future. Thank you for your time.